It is Tuesday, September 1st. Joe Delaronde here with you. Welcome to the COVID-19 Task Force update. It is our 124th program, and today promises to be a big one and an important one as we get ready to open the schools here in Kahnawake. We'll be hearing about that. Also, some of the issues that will be discussed will be about some of the measures being taken to ensure the health is taken care of, the health aspects are taken care of at the schools here in Kahnawake. And then at the end of the program, I guess we can say the keynote speaker, we'll be welcoming back Dr. Annick Gauthier of the Kahnawake Memorial Hospital Center. We haven't had her on for a while, so we're looking forward to that. Just before we start, one small bit of housekeeping. Didn't mention this yesterday, I should have, but there is a new way, if you are visiting your family members at the Kahnawake Memorial Hospital Center, there's a new way to make your, get your plans in there, because you don't just walk in, as we know, you have to give a call ahead. So if you have a family member you need to visit, contact 450-638-3930. Let me say that again. 638-3930, and contact extension 2296, which is the same number as the testing site. So you do that and you can make your reservations to meet your family member. And with that, we will get right along to the program. We'd like to welcome the Executive Director of the Kahnawake Education Center, Robin Delaronde. Robin?
It's my pleasure to be here once again. And today what I'm going to be doing is I will be providing the community and parents with information regarding two documents which I know parents and community have been anticipating and anxiously awaiting to have access to and to gain more information. So for today, I'm going to be explaining and going through two documents. And first, I'm going to start with the KEC Home Learning Program. As most of you may or may not know, that this program that we've developed is a program that was essential to provide as an alternative to concerns that were expressed by our community and by parents of our school. Basically, what we're doing is we're responding to those concerns, and I just want to go through the particulars. As of today, this afternoon, I should say this evening, both of these documents, parents and community will be able to access them in their full entirety on the KEC website. In addition, we will be sharing them on our respective schools and our KEC Facebook page, so you will be able to have that access to them. So first and foremost, I want to go through some of the details and particulars that are in the KEC Home Learning Program, COVID-19. So this is the document that when you go onto our site, you will be able to see this document in its entirety. Within this document, obviously, you're going to be seeing the reasoning why we decided to offer this type of program to students who are in our community schools. It will be addressing particulars in terms of the eligibility. Only students who are currently enrolled within our schools are on a KEC nominal roll are going to be eligible to partake in this KEC Home Learning Program. What we've identified is that, as I stated, they'll be in the document. You will see the eligibility criteria, as I had already stated, and also talking about there's particular registration procedures required to be a part of this program. Obviously, we have our normal school registration, but there are procedures here that you must fulfill and fill out forms. We also talk about the school's responsibility as part of this program. It is really vital and important that parents know that although we are responsible for certain elements in this. The actual teaching and educating of the students will be entirely upon the parents who wish to partake in this. But there'll be particulars in here stating what are the provisions we will be giving. We will be providing instructional material such as iPad, Chromebooks, and at this time though we do ask that if you already have a device at home, to please utilize that device, because unfortunately we have placed our orders, but because of the demand, there's been some delays. So we are anticipating they'll all be coming in within the next few weeks, but if you do have a device, we ask that you please use your own. We will be providing learning outcomes to parents in terms of what are the goals they need to attain. We are going to be monitoring progress. We are going to be ensuring that there are going to be different points in time where we are going to be connecting either with the student or with the parents to ensure that progression is occurring. If any students have individual education plans or have other alternative services that they require, that too will be put into the program and considered, obviously. So those are periods of time you'll see in the document where we have resource teachers or other supports that some of the students either already have in their plans, whether it be occupational therapy, speech therapy, that these are provisions that will be provided as well. One of the key areas that we also know we need to partake is that there will be, because of the vast amount of work that's involved, it is really something challenging for our classroom teachers to be able to monitor, as well as the schools themselves in terms of administration or other personnel. So for this reason, each of our schools have identified a distant learning teacher or teachers to support the different grade levels. So tomorrow, each of the school administrators will be talking specifically about who they are and what that entails. But for example, we may have nursery to kindergarten and grade one particular distant learning teacher who will be designated to support families who are accessing the home learning program. We want to make sure, though, is that in the event that the parent identifies the lack of progress or oversight in terms of the student learning, that we will be meeting with you. We will be discussing what are some of the challenges you're facing and concerns. So we are, and someone will be there to support you along the way. So in the document, as I stated, there will be clearly identified the role of the distant learning teacher. There will be an overview of the roles and what that entails for parents, so that they are able to see what's going to be the role of the classroom teacher, because your child will be assigned to a class and a classroom teacher. But you will also see what is the role of the distant learning teacher and what is the role of a resource teacher in our schools. And for those of you who may not know, resource teachers normally collaborate and offer additional supports to students who require additional services outside of the regular school programming. What is also essential is that there is a parent and student responsibility, and I really want parents to make sure that they clearly review what their role is and what the student's role is as they engage in this program. It's important that they know that they are an active partner in this, and that they will be working with their child to achieve and working to achieve the expected outcomes. We also want parents to know that they must be present during this period of time when they're working with their child and supporting them. And we also want to make sure that they are part of the meetings that we do periodically schedule, that they make sure that they have made that commitment to these scheduled appointments. Parents must ensure that all deadlines for assignments, projects, and so forth are respected, and that they also are going to be a part of any other sessions of support that we provide. Curriculum resources, there's going to be identifying what type of resources we provide. That will be in there as well. We are looking at a Google Classroom platform to provide resources, but we understand that each of our schools is very different. Gauthier School, as many of you know, is an immersion school, and the resources may differ and the approach may differ in the delivery of resources, because for the most part they do not have as much a vast array of resources to provide through Google, so some of it may be actual hard copies and so forth. Also in the document we talk about monitoring and assessment. How will we monitor and assess the students? So that's clearly outlined in there, that it will be required, obviously, and summaries developed from the different benchmarks that we'll set. And communication, and that's clearly outlined, as well as attendance. I want to relay that by signing this agreement in terms of home learning, it's really important that we are working with you as parents collaboratively. We are expecting that the delivery and the teaching will occur. And with that, we will be marking students present with that expectation, knowing that they are receiving educational services from the home. And with that, we also have in there the opt-in and opt-out procedures noted, because we understand that, that parents at one point may opt in, but they may then decide to want to leave that program and receive specific on-site instruction. So that's clearly outlined. And then some other situations that help you as a parent to offer the best atmosphere for your child. There's also a home learning chart in terms of what is the best and preferable amount of times for students to sustain themselves if they're doing any form of online learning, and some questions. So with that in mind, like I said, you can thoroughly go through this document this evening or tomorrow. Particulars related to your specific school will be answered tomorrow, and I'll explain how that's going to be done. And but I do want people to know that elementary and high school differ in terms of the home learning. It's important to know that with the elementary, there is no I would say no on-site instruction required in terms of learning, because everyone knows that what we are offering at our schools is our students do come on site. But for the parents in the elementary sector, it's important to note that for them, yes, there could be some on-site, which would mean maybe for an assessment coming into the school, and that might be one-on-one or a small group, but that would be the type of on-site. So this is primarily the for elementary. High school has a blended approach, meaning that in the high school at KSS, what they're offering is they are going to be having some days where it's online learning and some days on site. So we know that some parents are preferring not to send their child on site on those particular days, and we will be working to coordinate what would that look like if your child is not going to be on site. So you would still have to sign the agreement in terms of your responsibilities. The next document I just want to go over briefly is the parent guide that will be online as well. This parent guide is really, we've taken key elements that pertain to parents, what parents may want to know about us as we open our doors and the safety measures that we are taking. It comes from the comprehensive document that we've been working on from the KEC Schools Reopening Guide. It is a extremely comprehensive document, and not all of the components in there are really relevant to parents. So what we did is we took out components that we felt at this time parents would be really would really be interested in and reviewing. In this document, what we've done is we've taken parents through what are the protocols and requirements that are expected of our educators, our staff, when they walk in our doors, and what is the expectations that we have of your children, as they walk through the doors and come into our schools. Everything from the daily health checks that must be done prior to coming in, what we expect, both from our staff and from you as parents supporting the children before they walk in the door. It goes through the mask etiquette in terms of requirements, who is and where is it mandatory that children wear masks. And that's all laid out and determined in here in this document as well. At this point in time, we have confirmed that we are going to make masks mandatory from grades 3 up to grade 11. We are encouraging that if from nursery to grade 2, that we are encouraging students to wear them. And this is something where we understand that we may have to go through a process of training the very young children. And we will make those measures to look to see what is the best way to do that. So at this point in time, it's grade 3 to grade 11. And you must understand that everything in this document can change daily or weekly. So please be advised that the information can change. So it goes through the responsibilities of the teachers. So what would teachers do in terms of keeping the classroom clean, the requirements, our ventilation, the student code of conduct? What do we expect from the students? And it might be very important for parents to go through this and look at it and discuss this with your child prior to coming into our schools. The roles of different people key in our schools and what their role is with COVID-19. And then the general protocol for our staff at school and once they leave. We have in here common work areas, the lunchrooms and so forth, and what would happen. We talk about washroom protocol, so you would know what our staff, it's required when we go into common work areas, and for the students as well, what is required of them. The arrival of students who are bused and the departure who are bused is clearly outlined. And also, if parents are picking up or dropping off their students, procedures are in here as well. We also have clearly outlined the protocol for visitors who come into our school, what we're expecting. And we have clearly outlined here the food service procedures and hygiene and safety in terms of what we're going to be doing to make sure it is a clean and healthy school environment. We also have put in other additional charts here for parents in terms of how to wear a mask, quick reference guides for you. Also, we put in here a chart that will clearly help you that if you do come into contact with someone who has tested positive for COVID-19, what you should do, and also information about isolation rooms and so forth in our schools. It is very important that you read through this guide, and if you have any questions, we'll talk about how we can address that later. But we are very proud of the comprehensive document for parents that's in here. These two documents, when we surveyed parents a few weeks ago as to what their intentions are in terms of either sending their child to school or keeping them home to engage in the home learning, these two documents, the intention is that now you will review them, you will look at them, and for those parents who we initially surveyed and who were undecided at the time, or who may have said, after looking at this, have now said, no, I changed my mind. We would like you to give time to look through them. And once you've read through them, if you have changed your mind, or if you now have confirmed a decision, or we were not able to reach you, that we ask you to please make sure you now contact the school by Friday to let us know of your intentions. The other important thing I would like to relay is that tomorrow at 11 o'clock, we will be going live on KahnawakeTV. We will be, what we will be doing is having each of our school administrators present to talk specifically about how these guides work within their schools. What are their specific school reopening plans? So I will be there as well as Jason Calvert, who's our operations manager, And we will be just giving some brief information, but we would like our school administrators to speak to the community or to parents to go into more details about specific schools. And at that time, we will, if there are questions, we will try to go through them and be able to respond to at least some of the questions. And we are really hoping to stick to just at the most a 1 hour live broadcast on KahnawakeTV live tomorrow. With that being said, this is the information that I wanted to relay today. Like I said, you will have access to these documents in its entirety to look at them on our website, and also a link on our school Facebook pages. I'd like to once again thank everyone. Thank you for your patience. It's been a long task and a lot of involvement and commitment with many different people to be able to get these documents to the community. And I thank you for your patience. Kahnawake.
Thank you very much, Robin. And I know I've said it before, and on behalf of everyone, we really do appreciate the incredible amount of work that has gone into preparing for this very different school year. And I know everybody's been doing their best to make sure that everyone is safe and healthy. Speaking of that, we'll now be joined by Juanita Belanger. She works at the community health unit as a nurse over there. She's also the infection prevention and control nurse. So she's going to join us to talk about some of the measures that will be used to help ensure that this school year is a safe one. All right? Juanita, it's all yours.
Thank you, Joe. So I was already introduced, but I'll say again, my name is Juanita Belanger. I am one of the nurses at the KMHC. Currently orienting to be the new infection prevention and control nurse. I will be replacing Leslie Walker-Rice as she will be retiring. And I also work in the community health unit as a school nurse. So I'm here today to speak to you about the role of the KMHC in helping the KEC get their plan rolling and make sure that it goes smoothly and safely for everybody, and we keep everybody as safe as we possibly can. So we have the plan, and we have recently been speaking with staff, administrative staff, the safety committee, as well as teachers and maintenance staff in a variety of ways to go over what the KEC plan has in place and to help the school to best put everything into place so that the staff feels comfortable protecting the students have the information that they need, and that the hospital can support them in the best way that we can. So how are we doing that? What we're doing currently is we're going to do teaching. We want to make sure that all staff understands how to use PPE, so personal protective equipment. There may be times when it will be necessary to use this, so we want to make sure that all staff is trained and they understand how to put on and take off any of the PPE that may be necessary for them to use. So what we've done is we've met with the individual schools, and we're still in the process of meeting with the schools, and we're giving a visual sort of walkthrough of what you would do if you needed to put it on and take it off. So it's very important that this is understood, because there is a sequence for putting on and taking off. So we want to make sure that everybody knows that, and we will be providing posters to put up in the schools so that nobody will be expected to remember everything. They'll have the information that they need. We'll also be showing cleaning staff and students how to, properly wear masks. So it's very important that when you're wearing a mask, you don't just slap your mask on and take it off and do whatever you feel. It's really important the way that we put on a mask, the way that we take off a mask. If we're not wearing it, how do we store it? So we want to make sure that everybody has that information, and that's one of the things that we're giving to them. We're going to talk about hand hygiene, which we've all spoken about millions and millions of times through this whole experience, but we want to keep reiterating the importance of it. So we want people to know when to use it, when it's appropriate. We want to help the teachers know when to cue the students so that the students become habituated to doing it as well. So that's one of the things that we're doing. And these are all things that nurses have been doing in the schools for years, but we're obviously spending a little bit more time on this during the pandemic because we want to make sure that everybody will remember. Respiratory etiquette is another important thing, so we want people to know, what to do if they cough, if they sneeze. So this is training that's being provided in the schools. One of the important things is the classroom. So we don't want classrooms to be cluttered with things. We want to make sure that everything is very clean. There's not a lot of stuff everywhere, so it's really important that we get across the environmental cleaning practices that are expected. So we are going to teach the kids a little bit about, keeping their own personal space clean, not sharing, which is really so opposite of what we teach kids normally, but in this instance, we have to. So we don't want them sharing pencils. We don't want them sharing masks. We don't want them to be, in each other's space any more than necessary. And we do believe, as school nurses, that we can get this information across to the kids and that they can process it and they can learn. So one of the things that we're going to be doing is going into the classrooms and teaching the kids all of these important lessons as well. We also plan to make videos, so that will enable the teachers to give this information to the students on a regular basis to remind them. Nobody's expected to remember everything all the time, so that's one of the important steps that we're taking and innovating in some way to be able to give information in a different way so that we don't always have to be there and we can minimize the number of people that are going in and out of the schools. What else? So there's so much. One of the important things that I think we need to talk about is the reality that parents are facing right now, and that's that they're worried. They want to know that there's, something in place that's going to protect their children. The staff are worried. They have been probably, out for months up until now, and they want to know that they're going into something that's safe and that there are processes in place that will keep them safe. So we're trying to support them in not only giving them this information, but also in the way that we deliver the information and being sensitive to that. And that's why it's so important that we're here today. We want the parents in the community to understand that this is a collaborative process. We are really working together with the education center. We are working with the staff. We are working with the janitors. We're working with everybody because we believe that this is really a team effort. And so we want everybody to understand that there is really going to be hopefully no stone unturned in terms of what could come up. Questions will come up every day. We will do our best to answer them. Sometimes we won't have the answer right away, but we will seek it out. And if somebody does get sick, God forbid, because this has been really, really great the way that it's been handled in Kahnawake, but if somebody gets sick, there's a process in place as well. If a child gets sick in the school, they'll be isolated, and the teachers and staff are all aware of what this process is, and the KEC has done a wonderful job of making sure that there is a process in place, and we are training the staff in that process. So we also, luckily, at KMHC have a local public health team, of which I'm a member, of nurses that will handle the contact tracing if there is an issue. So we have a lot of in-house things that are going on that enable us to be really connected within the community to all of the different players and to the community at large to ensure that we can maintain safety as much as possible. So having said that, I just wanted to say one last little tidbit. So as one of the school nurses, I've been working collaboratively with Step by Step through this entire process from the beginning. And Step by Step was one of the emergency daycares, so they have not closed down. They've been opened and they have had students. And so at the beginning, we had to troubleshoot a lot of things because everything was new. And with Natalie Bova, who is wonderful, we've managed to come up with a plan and a system that's working very, very, very well. So children have been dropped off, little tiny children who, don't understand social distancing and who are covered in germs and God knows what else. And they've been there, and it has worked. It has been safe. We've put everything in place to make sure it's safe. And I think that we need to remember that. And so if we look at step by step as sort of a gold standard of what we want to achieve, I think that we can achieve that if we work together. And we all have to remember that we have an individual responsibility to this as well. So parents who are worried about what's going to happen when they send their kids to school need to also remember that everything that we're doing at school does not stop at the door. It doesn't stop when your child gets off the school bus. It's got to be a process that we're doing every day in our everyday lives, outside of school, inside of school. So remember that, you know, when you pick up your children from school, you still have that responsibility to continue to practice social distancing, to practice hand hygiene, to wear masks when you're out, to limit the number of people that you see socially. These are all things that are going to help us as a community not only allow students to thrive and get the education that they need, but at the same time, we are by extension going to protect the elders, which is, I think, what we're all really trying to do here. So I appreciate your time today. Thank you so much for having me, and I will see you soon. Take care.
Very beautifully done. Thank you very much, Juanita Belanger. And just a little note, since we're on, and today's entire program basically is about education and school and what is going to be happening. Robin mentioned that they're going to be broadcasting on KahnawakeTV tomorrow at 11 a.m. We'll also be carrying that on the Kahnawake 911 page and also on the MCK Facebook page as well. So hopefully as many people as possible will get to see that important program tomorrow. Well, it's time to bring back Dr. Annick Gauthier. She hasn't been on for a while, and I have to say that in Kahnawake, when we go back to July, when the businesses opened up, there was a lot of worry, but we got through that. And now as we get into education and schooling, I think we've reached a new level of concern because people are talking about their children, and when we talk about that, that's you know, the main thing in our lives, I guess. So it's a good time to bring back Dr. Gauthier to talk a little bit about that and more. So let's welcome her back.
Nyawagoa Joe, and actually Nyawagoa to the people of Kahnawake for really holding the line of distance, hygiene, and masking with this careful, slow, and maybe too slow for some, but very deliberate reopening first of businesses, restaurants, outdoor activities, and gyms. We have not had any cases of COVID-19 in Kahnawake since May. And that's despite communities that are just around us having major outbreaks. So really, Nyawagoa, like, congratulations. You really worked hard. And I know this is hard work. So now, I think everyone's stealing my thunder, or they saw what slides I was going to talk about, but we are now sending our children back to school. And because people actually ask me what I'm doing as a doctor and as a virologist, so my kids are attending school. They're attending school in Montreal, and while it's not mandatory, I have asked my daughters to wear their masks when they're sitting in the classroom, when they're less than 2 meters away from anyone. To do hand hygiene regularly. They have little packs in their backpack. They have a little bag of clean masks, as well as a cotton bag to put the dirty masks in, already in their backpacks. But I get it that people are worried. The other thing that I'm doing is, just like all of you, I am doing a health check every morning with my kids. And so I'm looking at a group of 9 symptoms, and if they have any of them, they will stay home. And the same thing for the teachers, and this is exactly what we're using in Kahnawake at the schools and at the daycare. So we're looking at fever and chills, new cough or worsening cough, difficulty breathing, sudden loss of smell or taste without nasal congestion, new onset headache, new onset pain, whether that's in your body, in your muscles, your chest, or your tummy, new intense fatigue, sore throat, diarrhea or vomiting. Any of those symptom groups, you stay home. Just need one of them and you stay home. And that's what, remember we talked about before, is creating a culture that it's okay if you're sick, the best place is to stay home. And if you have those symptoms, you can call the KMHC testing center and see if you should be tested for COVID-19. Now, as a mom, I get that you're worried about sending your kids back to school. You're worried about them, the kids, you're worried about yourself, you're worried about your extended family. However, as I said at my very first Facebook Live back in March, fear is fed by misinformation. And so the best thing to relieve that anxiety is to get the correct information. So there's lots of resources. Robin spoke about the KEC guide, the parent guide. I haven't actually seen how many pages it is, but I challenge all of you to read it just as many times as I have. We're now on version 12 of the 69, actually no, it's now 66 page overall guide. I have read that 12 times. So I encourage each of you to do that. I would encourage you to do it in daytime hours rather than in the midnight to 2 a.m., which is my usual theme. But I encourage you, and we can actually, I'll put money on it or something if that's going to help people. But really you should do this because it's going to help quell your anxiety. It's going to help you feel comfortable and knowing that your kids are being put in a great place with great plans in place. So I also am going to talk about a little bit of some misconceptions. So there's a big fear that school is more dangerous than anywhere else, and that we're like, oh no, we're starting school. And I want to bring us back to when we opened up the cigarette shops. Now, again, I'm a doctor, so I don't encourage people to smoke, and people who own the cigarette factories, many of which are my patients and so on, I'm sorry for saying this. I'm not encouraging people to smoke, but remember when we opened them up and everyone was freaked out in town, and I was like in my clinic and getting like tons of texts for trying to deal with things? And you know what happened? Nothing. It was good because we had great plans in place. We had those inspectors ensuring that everything was well placed and well arranged for physical distancing, for hand hygiene and so on. The same things are going on with the school. Now, I want to talk about level of risk because the issues that we always talk about are distance, hygiene, and masking. And distance isn't just 2 meters. It's about what kind of activity you're doing. So Jones et al. Published a paper that in British Medical Journal recently that's made the rounds in the newspapers, that it's a combination of things. It's not just 2 meters, or it's not just 1 meter. It's what the distance is, what the activity is, what personal protective equipment is being worn, how long is the interaction, and what type of activity. So I actually have a slide that they're going to show up, and apologies that I did not give advance notice to the technical team. From the BMJ 2020. So it's looking at the risk of SARS-CoV-2 transmission from asymptomatic people. And you have at the top of the screen, on the green, is sort of the safest things. So that's things where you have far distance, things where you're outside or you're inside with great ventilation. You're wearing masks. It's for short time periods. You're speaking and not shouting or singing. The riskiest down in the bottom corner with the red, that's where you have close proximity. Inside, it's poorly ventilated, no masks, long time periods, shouting or singing. So that's why we've seen and across Canada and the US where we have instances of choirs singing inside one environment while no one's symptomatic at that time, and they did their health check before going. Because they're in such a close proximity and you know, using their haute voix, not using their inside voices, they're shouting out and singing beautiful music. That is probably not the best place, and it's probably one of the riskiest things you can do for COVID transmission. So that's why singing outside, being 2 meters apart, those are the things. But it's not just about distance, it's about all these factors. Thank you very much. You can take down that slide. And that was my only slide for today. The second point I want to bring up is kids and spreading. Kids transmit the disease. At the very beginning, we said no, they couldn't. Then there was data that maybe they could. Well, now, after 9 months, we've had collected a good amount of data, and it really is that kids get COVID-19 from their household members and not from their friends. Okay, we're talking about kids that are under 18 years old. And now we have multiple studies showing that kids that are under 10 to 12 years old don't appear to transmit COVID-19 very well. Kids over 12 years old, as they get up to adulthood, they transmit at the levels of the rest of us adults. Now, why is that? We're not really sure. It's probably a lot about immunity to other types of coronaviruses in the younger age group, because they're just encountering all these regular cold viruses, so that's rhinovirus or flu or other coronaviruses, and that's causing them a little bit of immunity that's sort of affecting how they see SARS-CoV-2, the causative agent of COVID-19. Now, studies also show that people under the age of 20 are about half as susceptible to COVID-19 as adults. Now, in-school learning versus distance learning. So in Kahnawake, we were able to make the decision as Kahnawake Education Center and the task force that parents would have the decision if they would send their kids to in-school learning or distance learning at home. Now, Robin's talked about it before. We did a survey in mid-August, and 50% chose in-school learning and 50% chose distance learning. And remember, just to call back to what Robin said, by Friday you have to put your decision in firmly with and formally with KEC. Now, I want to make it clear that Kahnawake, the KEC, and the task force have no jurisdiction outside of Kahnawake. So outside, it's the Quebec government and the MES, so Ministère de l'Éducation et Enseignement Supérieur, that gets to decide. Now, it's still every parent, whether they live here or anywhere else and send their kids outside of Kahnawake to school, have the right and ability to not send their children to school. But that means they do homeschooling. Now, it was the government of Quebec with NSPQ that made the decision that all children need to attend school in person. And it's every day for kindergarten to grade 9 with the whole class bubble as their concept. And the grade 10s and 11s, either it's every day using that bubble concept of the whole class, or doing it every other day. Now, there is a possibility of having distance learning in the rest of Quebec, and it's for that very small percentage of people, and I'm going to talk about it and give you some examples afterwards, that have a medical exemption to attend school in person, and they can access the Quebec distance learning. Now, I really want to make a point, because I'm not necessarily my patients within Kahnawake, but my patients outside of Kahnawake are often under the impression that if they get a letter to do distance learning, that it's going to be their teacher, like their kid's usual teacher, that's going to be teaching them. So like, example that this would be the kid that's on distance learning and the teacher would be teaching there and then teaching the rest of the room here. That's not how it's going to work in the rest of Quebec. How it's working is that there will be for the English schools, so through the school boards, there will be a certain sector set up to be a teacher for all of the kids that have access to distance learning. And for the French schools, it's through their service centers, because they've abandoned the school boards. For some of the private schools, they do have the ability of having those private school teachers are teaching, but again, it's not a fait accompli. Now, off reserve, if you can send your children to outside schools, I urge you to write letters, just like I have done, and call their MNAs, members of the National Assembly or their députés, and address your concerns there. Write letters. They actually make impacts. The more people who send information and more complaints, but the thing is that you can't just send a complaint to the task force, because we have no abilities to make changes for the rest of Quebec. Now, that leads me into who is the most vulnerable for COVID-19. So I want to be honest, at the beginning, myself, other doctors, scientists, we were concerned about everyone. That's why we shut everything down. Everybody went inside. We had, in Quebec, as you all know, and I've said this multiple times, we have the worst death rate per capita in the world. We're in the top 5, even after everyone's going through and other people have already started having surges of second wave. Quebec is still in the leading groups. So therefore, we really were very worried, understandably, at the beginning. But now that we have 9 months of data, we actually have more clarity in what really puts you at risk. And it really is having uncontrolled or complicated disease, or highly immunosuppressed. Those are the things that put you at greater risk of COVID-19. An additional point is age. So over 70 years old puts you at greater risk of getting COVID-19. And that's why from the very beginning we've said, for those that are over 70, it's staying 2 meters away from others, wearing masking, doing hand hygiene. It's not going to parties. My parents are over 70. It was my birthday this past weekend, their 50th anniversary, and we met, but outside. And we each, as a pod, had our own food. We chatted from afar. Maybe the neighbors could hear us chatting too, but that's okay. And that's how we do to keep them safe. Now, the vast majority of people who just have diabetes or COPD or asthma who are under control, that doesn't put them at greater risk. Everyone should be doing the distance, hygiene, and masking measures. Now, Public Health Quebec, NSPQ, as well as a variety of the specialists and disease societies of Canada, US, and so on, have come together and they've actually come up with guidelines of who is vulnerable to COVID and who is not. These guidelines have nothing to do with the task force. These guidelines were set up by the medical establishments that are looking at these data, that are following their patients with Crohn's disease. They're following their patients who are receiving chemotherapy. And they were able to look and see what happens in those populations with COVID-19 across the world. So the fifth point is doctors have to follow the guidelines for work or school exemption. We have to follow what the NSPQ and these specialty societies have suggested. We are not allowed by law to write a complacency letter putting someone off work when they really shouldn't be off work. It's actually against our order, and it's against what we're allowed to do. Now, 6 is if you live or you are personally have a family member that is at great risk as determined by their doctor, as determined by these guidelines, then really no one should work outside the home if they're really requiring that much personal care. So I want to make it clear that it's not going to school that's the problem. It's actually overall, you have to make sure that you are doing distance hygiene. And that's why, remember, I talked about for Mother's Day that you would just buy some flowers for your mom and put them on the doorstep, ring the bell and run away from the end of the driveway and chat with them from there. That's what we're doing. Now, if someone needed more help than that and needed someone to live with them, to take care of them, to help them cook, to help them do things, then maybe that other person, that adult child, should not be going outside and should not be doing and interacting and going to other places, if possible. Is this difficult? Absolutely. It totally is difficult. Are there benefits for children having close contact with their elders? Absolutely. But are there risks for children having close contact with their elders? Absolutely. So that's why I'm proud of Kahnawake for leaving that decision to the families to decide to send their children to in-person learning or distance learning. However, if your child goes to school outside of Kahnawake, you're not de facto at risk. You can do things to protect yourself, your kids, your family, and the community. You can distance, you can hygiene, you can mask, you can have physically distant gatherings. You can go and read the parent guide. That will help you, even if it's not what's being done in your school. Almost every school that I know of, because I've read many guidelines and been asked by many schools and school boards to read and give my comments and validate their guidelines, I know most of the schools have given guidelines out. So please, I urge you to read them. Go through them. Go to your school's Facebook page. Read what information is there for you. So now I'm going to run through a few examples. These are not real examples. I mean, they could be, but they're not based on actual individual people. No one actually came out with questions that were related to their children or their disease state, and that's okay. That's a personal thing and private thing. If you go now and write them on the Facebook page, it's not going to help because I'm not answering this live. So let's take an example with a person like myself. I have asthma. Or take my uncle who has COPD. Well controlled, both of us. I have very well controlled asthma. I rarely use my Ventolin. Or I could even take a friend who uses they have to use their flow vent every day, but they're super well controlled. They don't have asthma attacks. They haven't been admitted to the ICU. They haven't been admitted to the hospital more than 3 times in the last year. So they're very well controlled. They can go to school. They can work. You all see me. I've been working through this entire time. Of course, where I can, I distance. I do hand hygiene and I mask. Same as all these other people. Second case, a person with Crohn's disease, so inflammatory bowel disease, no active flare. They're taking a biologic like Humira. And I don't make any money from Humira, so it's no issues. That person, well controlled, they can go to school or work. Again, they still have to distance, hygiene, and mask. And you could play a drinking game at this Facebook Live afterwards for young people. Alone, you could, be not too young, above 18, because that's the legal drinking age. They're all laughing at me in the room. But yes, for how many times I say distance, hygiene, and mask throughout this presentation. The third is a child with Crohn's. Again, same inflammatory bowel disease, or maybe they're an adult with Crohn's, but they're actually having an active flare. And because it's just before supper hour, I will not explain what an active flare can look like in the toilet, but it's not pretty. They've seen me or their gastroenterologist, and now they've been put on steroids of greater than 20 milligrams of prednisone per day. They should do distance learning because they are at such a level of high immunosuppression that they are at greater risk, if they do get COVID, of having severe complications. So in that case, the child should stay home. Now, if that child, likely because they're that ill, or even an adult that's that ill, might need a caregiver, might need an adult, a parent, or an adult child to take care of them. So they might actually have to isolate with the child, and not, maybe the rest of the household continues about their day, going to school, going to work, but the child and the parent stay together in a room and are like at least 2 meters from the rest of the family. So these are the kinds of things you have to think about. For a child or an adult with diabetes that's well controlled, they take metformin, or even if they take some insulin, but their diabetes is well controlled, they can go to work or school, again, with the distance, hygiene, and mask. Okay, chemo patient, oncology patients or a person with cancer receiving active chemotherapy or radiation therapy that cause severe immunosuppression. They were never supposed to go to school or work before COVID, so obviously they're not supposed to go to school or work now. So like that's just it, and those people should know that. If they don't, they should discuss it with their oncologist. Now, the siblings and the parents of those kids often can go to school and work, but again, maintaining really strict hygiene measures. However, again, just like the kid with Crohn's having the flare, the parent might need to take care of them. And if they're taking care of them, maybe that would be a reason to be off school or work. And then again, that's a case where this would have been the case prior to COVID. All the issues, like, you know, while it's true, diarrhea and vomiting are not a common thing to see with COVID, or diarrhea and vomiting alone are not a common thing to see with COVID, we still don't want you to send your kids to school. I don't want you to go to work if you have diarrhea or vomiting, because that's just gross. So just stay at home. Gastro still exists, even if COVID exists. A person that had cancer previously, so they have no active treatment, they're doing well, they're like, maybe they had a breast cancer, breast was removed, they're not taking any treatment, they are no greater risk. There's also some chemotherapies that actually don't increase your immunosuppression, and those people are not at any greater risk as well. But again, speak to your oncologist if that's your case. Now, something that people don't talk about a lot, but I think is important, is my 7th case is an obese person with a BMI of greater than 40. So how do you visualize that? So I am 5'6", or actually 5'5" and 3/4", but I like to say I'm 5'6". I would have to be greater than 250 pounds to have a BMI of greater than 40. And they, just being obese alone, like morbidly obese, they are at higher risk for many issues and a higher risk of, if they get COVID, of complications. And therefore, they should really maintain strict 2-meter distancing, hand hygiene, and they can work if that can be maintained at work, just like everyone else could work if they could maintain these things. Or they do télétravail, so work from home. Ideally, they would actually just stay in their yard or in their house. They wouldn't actually go outside of that. Their kids could go to school, but again, maintaining all the measures. Next case is a family with 2 school-age kids who want to visit their 75-year-old grandma. So the kids and the parents can go to school and go to work. They have to maintain all the hygiene measures, but they shouldn't visit 75-year-old grandma in grandma's house. They could maybe meet outside where grandma's 2 meters away from them. I get that that's not how you want to live, but even now, by having your kids play in the park with each other, they still shouldn't be seeing grandma. They still shouldn't be hanging out with other kids and then going to see their over 70-year-olds. Now, a case where you're living with a 75-year-old grandma, so same family, 2 people, 2 kids, they live with the 75-year-old grandma, but the grandma is super independent. and goes out around the community, goes shopping, does her business, those people can likely go to school and go to work, but still maintain all hygiene measures. Now my last case is living with 75-year-old grandma. We still have the family of 2 adults, 2 kids, grandma, but grandma's not well. Grandma, for whatever reason, I don't know her medical background, but she requires a lot of care. So she's not able to feed herself, she's not able to dress herself. So that means someone actually in that should be part of her direct bubble of really taking care of her. And that would be a case for doing télétravail, so working from home or distance learning. So I'm trying to give you through a few different criteria. Now I know I've talked a lot, I always talk a lot, so that's why they usually try to just have me speak, but this time we had a lot of material to cover. I do want to cover one last point because it's something that came out last week on August 27th about isolation criteria changes. Now again, we're in a great situation, Kahnawake. We have not had any cases since May. So potentially, if we can knock on some kind of wood that's around here, there's nothing else, I don't want to touch anything. We don't get any more cases, and maybe this will change by the time we get a case, if we get a case. But the isolation criteria has gone down. Before, if you were diagnosed with COVID, you had to maintain strict isolation for 14 days after your either symptoms started or you got a positive test result. And then you could go out and break the isolation once you had been 14 days, that you had been feeling better for 24 hours, so all of your symptoms have sort of subsided, and you have no fever for 48 hours. However, they've moved this down to 10 days now. So I know in the media, there's a lot of been like, oh, that's because then the teachers only have 2 weeks off work, and it's not, okay? They actually looked at the actual scientific data behind this. And so really, it comes from a variety of studies that I've read and validated myself, looking at people can shed little bits of non-replicative. Remember, viruses don't live, so I can't say living virus, because even in the Quebec have been talking about living virus, which drives me crazy because viruses don't live, but they can't replicate. So basically, after even 30 days, some people can, after having COVID, still shed in their nose, but that's just little bits of RNA that are stuck in the epithelium inside the nose and the oropharynx. That's not virus that actually is infectious or contagious. And they know that because you can take virus, and coronaviruses are pretty easy to grow, and you put them in cell culture and grow them. We're only able to do that to about 5 to 10 days after symptoms start. And so that's why we can reduce the time down to 10 days. Now, if someone is immunocompromised and severely immunosuppressed, so like that kid that I was talking about that was taking the 20 milligrams a day for prednisone because of his IBD, ends up having a COVID infection, I'm sorry for this little kid that I'm making up, they actually have to be in isolation for 28 days after their symptoms start. And the reason for that is when you are immunosuppressed, your body isn't able to mount that immune response, both that B cell antibody response and that T cell cell-mediated response. It's not able to do that if you're immunosuppressed, and therefore that's why you need the virus that is still able to replicate, and they're still able to grow it. And the studies with that show that they can grow it up to at least 20 days. So that's why they have changed from 14 to 10 for the regular population, and it's gone to 28 days for immunosuppressed. Again, this is about people with disease that's been pretty well controlled. They've been able to stay at home. Now, anyone who still has symptoms or has been hospitalized or intubated or at the ICU, that's a different scenario, and public health is aware of that, and we have all these details. But sometimes it's too much information to get everyone. But what I want you to keep in your head is that there are lots of interesting science about this. I did receive a couple of interesting science questions, but I wanted to keep it to education and this isolation criteria. And I've spoken enough for today. On the people level, so on the person level, I want you to remember distance, hygiene, and masking, so that on the systems level, we can do testing, tracing, and isolating. And with that, we've got this. Your kids are going to be safe, you're going to be safe. Nyawagoa.
Thank you very much, Dr. Gauthier. And as I know there was a lot of information on today's program, but remember, how did she say it exactly? Fear is fed by misinformation. So get the right information you'll do okay. We'd like to thank our presenters today, Robin Delaronde from the Kahnawake Education Center, Juanita Belanger from Cattery Memorial Hospital Center, and Dr. Annick Gauthier. On behalf of all of us, Nyawko Adano, Onigiwahi.